Welcome to Vertical Movement PT. I'm Dr. Cindy Kimmy, physical therapist, and today we are going to do a physical therapy routine to help reduce shoulder impingement. So if you ever felt a pinching sensation in your shoulder when you were reaching above your head, putting something away in a cabinet, or lifting up something heavy over your head, then this routine is perfect for you. So go ahead and find a comfy spot and let's go ahead and get started. What is shoulder impingement syndrome? Very commonly, shoulder impingement syndrome, it goes along with rotator cuff tendonitis. Why, you ask? That's why I think it's important to go over the shoulder joint to really understand. So the shoulder joint is consisted of the clavicle, the scapula, and the scapula has a little portion of it called the acromion, and that's the top of the shoulder joint, and I like to call that the rooftop. Underneath that is the humerus. So in between the humerus and the acromion is a little space, and that's called the subacromial space. That's so important to know because what goes in the subacromial space is the bursa, which is the water balloon sac, and also the rotator cuff tendons. So the shoulder impingement syndrome, it's when there is a compression in the shoulder joint and the rotator cuff tendon and the bursa rubs against the scapula. It's that little hood of the acromion. So shoulder impingement syndrome happens commonly when you're doing repetitive activities, such as you're a tennis player or a volleyball player, you're an electrician constantly working on things over your head, or sometimes it can just happen through time and as we age. Next, we're going to go ahead and do the soft tissue mobilization of the pectoralis major and minor muscle right over here. So you're going to go ahead and place the ball against the wall and in between your chest. And you're going to roll the ball along the gradient of the fibers of your pectoralis major and then your minor, which is right over here. Okay, so you're going to go ahead and make sure your ball is clean so you don't get spots on your wall. Place it right over here and you're just going to go side to side. And when you find a spot that feels tender, you're going to go ahead and stop in that region there and go ahead and breathe into the ball. And go ahead and take 3 breaths. Okay, and then when you're done, go ahead and keep rolling until you feel like there is less tenderness and that you feel pretty mobilized. You can go ahead and pause the video right now and continue when you're ready. We are going to go ahead and start the mobilization portion of this routine. So the first stretch we're going to do is the posterior capsule stretch, and that's going to stretch out the posterior capsule. So we're going to start off with the left arm. Bring your left arm across, and your right arm is going to hook it and hug it towards your chest. You're going to feel a nice stretch in the back of your shoulder. So what this stretch is going to do, it's going to loosen the posterior capsule and create space so the humeral head of the humerus here, it can go back and you can hold your shoulders back. That way you're going to have less compression in the shoulder joint and therefore you're going to have a relief of the shoulder impingement symptoms that you're feeling. Hold this here for about 30 seconds to a minute. And as you feel like the range of motion opening up in your shoulder, you can bring the arm a little bit closer to your body for a deeper stretch. Okay, let's go ahead and switch to the opposite side. Right arm across, and your left arm is going to hook the arm close to your body. You're going to feel a nice stretch in the back of your right shoulder in the posterior capsule. Just make sure while you're doing this that you're sitting up nice and straight. You can also do this standing if you prefer. Just make sure you're not slouching because that is defeating the purpose of the stretch. So next, we're going to move on to our next one. We're going to do a dynamic chest stretch. And the dynamic chest stretch, it also stretches out our biceps. So the pec major and the bicep, they both attach right here in the front of the humerus. So just like the latissimus dorsi muscle, when these muscles are tight, it brings your shoulder forward, compressing the subacromial space. So the theme of today is opening up that space to reduce the shoulder impingement. So you're gonna go ahead, you can stand, or we'll go ahead and sit down on your legs here. Bring your arms behind your back here. Arms back. Hold that stretch. You always want to hold your stretch for at least 30 seconds to have any sort of effect. You can go ahead and incorporate diaphragmatic breathing through your belly. As you feel like the space opening up in your shoulder, you can bring your arms back a little bit more. Alright, let's go ahead and move on to our next mobilization. And the next one we're going to do is the quadruped rock packs. And what you're going to do, you're going to go on your hands and your knees here. And you're going to go ahead and rock back as if you're trying to sit down on your feet. And what you're going to feel here is that the humeral head of your humerus is pushing back on the posterior capsule. So it's opening up that space so you can bring your shoulders back. So there's a science and a reasoning to all of these stretches and exercises that we're doing. And as you feel like you get more range of motion, you can go ahead and sit back more and more into your heels or in your bum. But this might be difficult for you, especially if you have an impingement in your shoulder. So you can just rock back slightly. You don't have to go all the way and then come back. So the goal here isn't trying to have the most range of motion, but the goal is to stay in the level where it's a little discomfort, but you're not experiencing pain. You always want to stay away from the pain in these exercises. Very good. Let's go ahead and do about like 2 more. Just a reminder, you shouldn't feel any pain after doing any of these exercises or stretches. If you do, then you're probably not doing something right. And I highly recommend going to see your local physical therapist, just so you can get a proper diagnosis and to get an exercise plan that's especially for you. Okay? So the next exercise we're going to do is the thoracic extensions on the foam roll. So you're going to go ahead and grab your foam roll, and if you don't have one, you can go ahead and roll up like a beach towel or a towel, and it would do a similar effect, okay? So you can go ahead and lay this here, and you're going to lie down so that the foam roller is on the upper part of your back. So the reason why we're doing this, so before I go on, put your hands around your neck to protect it. Okay? So the reasoning why we're doing this is to improve the extension of our upper back so we can bring our shoulders back more. So you're going to go ahead and bend back, focusing on getting the mobility from your upper back, not from your neck. So your neck should be locked, should be protected by your hands, and your lower back also shouldn't be moving. You want to get the mobility from the middle of your thoracic spine, and that's the upper part of your back. And this also works with the towel, so don't forget that. once again, if this bothers you, you don't have to go that far back. You can just go slightly and come back forward. So a little goes a long way. What does that say? Rome wasn't built in a day. Do a little a day, and you'll be surprised at how far your body will go and how much improvement you'll get just from doing a little bit. Okay, let's go ahead and do 2 more. And last one. Excelente. Go ahead and slowly come back up. And especially if you have some shoulder pain, be very careful when you come back up. Okay. Next, we're going to go ahead and do the strengthening portion of our routine. Our first strengthening exercise is the serratus anterior push-ups. So the serratus anterior muscle, it connects right here from the fleshy parts of the 8th and 9th rib, and it goes underneath the shoulder blade, and it connects on the medial aspect here of the shoulder blade. So the serratus anterior is in charge of protracting our shoulder blade. So protracting, bringing it out away from the spine. It's also in charge of stabilizing our shoulder blade and the upward rotation of the shoulder blade. Why is that important? Well, when we slouch, our shoulder blade is downward rotation, pinching on the subacromial space. But if our serratus anterior muscle is strong and we have good posture, our shoulder blades go up into an upward rotation. So that's why we're doing this exercise. So the serratus anterior push-ups, you can do this either on a position of a full plank, or if it's easier for you, you can put your knees down and you can do a knee plank. And what you're going to do, you're going to push up through your arms, just like that, protracting your scapula, and back down. And push up, and back down. Make sure your neck isn't down just like that, but you have a nice and straight alignment, your core is tight, and back down. Push up, and back down. Very good. You can do this on your toes, by the way, if you're more advanced. And back down. And push up, and back down. Push up through your arms, and back down. Push up through your arms. Let's do 2 more. Push up through your arms and down. And last one. Up and down. Very nice. Okay, so the next exercise we're going to do is the scapular squeezes, or arm scapular squeezes. You can do this standing or sitting down. You're going to go ahead and retract your shoulder blades back, like you're pinching a pencil in between your shoulder blades. Back. So this is working the rhomboids, the middle trapezius muscles. And relax. And back. And relax. Just make sure you're not hiking up your shoulders to your ears while you're doing this. Back. And relax. You probably noticed that a lot of my videos, it includes scapular squeezes, because I think posture is so important and it's the key to most injuries, really. So if you're going to work on something, work on your posture. Last one, squeeze your shoulder blades back and relax. Next, we're going to do chin tucks, and that's working the deep neck flexors of our neck here. We're going to go ahead and retract your head here, getting your deep neck flexors nice and activated, and relax. And retract, and relax. Retract, and relax. Good job. Retract, and relax. Make sure you're breathing while you're doing these exercises. Retract. It's easy to hold your breath. You don't want to do that. Retract about 3 more. Retract. Ears aligned with your shoulder. Relax. And 2 more. Retract. And relax. And last one. Retract. And relax. Very nice. Our next exercise we're going to do is the lower trapezius liftoffs. And what that does is strengthen the lower trapezius. And that muscle helps with the upward rotation of the scapula. So similar to the serratus anterior. So you're gonna go ahead and go up against the wall just like this. And you're gonna lift your arms up and lift the arms away from the wall and back. So I'm gonna show you as if the wall is right over here. You're gonna slide your arms up the wall, lift your arms off of the wall and back, and slowly slide down. So you're gonna make sure that you're not hiking your shoulders up, but keeping your shoulder blades as if you're trying to place it in your back pocket. So you're gonna slide up, shoulder blades down, lift up, and back on the wall and slide down. Okay, so let's go ahead and do about 7 more of those. Slide up, shoulder blades down, core tight, lift off, and back, and slide down. Up, lift off, back on the wall, and slide down. Make sure your head is aligned with your body. Slide up, lift off, back on the wall, and slide down. Good work, everyone. Slide up, back off, back on the wall, and slide down. And if it's too painful for you to go up, you can just go up to the amount that you can and even slide down. You don't have to do the lift off if you're not ready for it. And up, lift off, and back, and down. And if this is painful, you can go ahead and skip this one altogether until you're ready for it. And back along, and down. Slide up, back, and down. And up, and back, on the wall, and down. Let's do 2 more. Slide up, and back, on the wall, and down. And last one, shoulder blades back, slide up, lift off, back on the wall, and down. Congrats, you are done with this routine and I am so proud of you. You could do this routine up to 2 to 3 times a week for 6 weeks. If you find that you're not getting any improvement after doing this routine, or you find that your symptoms, they got worse, please go see your local physical therapist because you need a specific routine that's just for you. If you like this channel and you want to see more videos, you want to support Vertical Movement PT, please subscribe and also please like the videos and comment. I can't wait to see you until next time. Peace.